The second case for the day, just getting done, and as you will see, this is complete end block 11625, initials LJ. So there was a lot of contouring done on this very nice lady, 55 years of age. She has saline implant from 2005, one set done through the armpit, the axilla. And she said this was likely above, and it turns out it was not above, but what is below the muscle, below. Now, as you can see, there's a lot of contouring done, and this is all fatty tissue. This is not breast tissue, and this is part of that pseudo-lift, where the implant over the years had moved down and outward. So this is the bottoming out, just by the gravitational pull of this round ball, if you will. Now, if I go turn this around, you will see a lot of inflamed tissue that I removed along with the implant capsule, all inflamed tissue, leaving behind the precious volume. Now she has a lot of tissue still remaining, which is the breast tissue and the obesity, the adipose tissue as well. So full thickness skin to help with the contouring. It really helps move the breast tissue medially and up so that she truly gets what is a pseudo lift. Now, as you will see as I go through, you can see it's almost saran wrap, transparent, thin. Let me go in from here, and as you will see, very ultra thin capsule. So sterile pair of gloves. As I go in, here we go. I'm going to cut through this to show you that. Look at that scar tissue right here, right? That's why I've had to remove it. And let me go in from here. So this is your 380. What it is, that saline implant. And look at that. Look at that. And this is your 380. So back in the day in 05, overfilled implant, intact saline implant. Back in the day, the silicone implants were banned. Now, what's interesting is we did like a webinar yesterday at noon, and the silicone implants were banned for cosmetic reasons from 1992 to the latter part of 2006. And now what's interesting is you could get it for reconstructive purposes. Now remember, at the end of the day, the silicone implants were banned, regardless of whatever reason, because remember, they were deemed safe not for cosmetic, and that's why there was a determination made by the FDA. Now, we all know they were not safe. That's why they were not put in for cosmetic reasons, but they were put in for reconstructive reasons. And the same thing extends to reconstructive. And the point here is whether it's done for cosmetic or reconstruction, at the end of the day, smoking is going to kill whoever is going to do it, right? Regardless of the age, regardless of the underlying reason. And same thing, if you overspeed, no matter what, you're going to run into problems. Implants, the same thing, be it saline or silicone, they cause the same hurt, whether it's done for saline implants, cosmetic reason, reconstructive reasons. Silicone implants for cosmetic reasons or reconstructive reasons. It was very, I use the word inappropriate to extend this just to cosmetic and not to reconstructive. And we know that many surgeons opted not to put in implants, silicone, even in reconstruction patients, because they felt ethically, because it was not safe, there was this breast implant illness, that they would not extend it to reconstructive patients as well. So in today's world and age, still the saline implants cause the same hurt as silicone implants, as ruptured silicone implants and ruptured saline implants. So all four, if you will, are interchangeable with cosmetic reasons or reconstructive reasons. Because at the end of the day, the shell of that saline implant causes the same hurt as the silicone implant, even if it's intact or ruptured. So going back to this saline implant overfilled, and as you will see, end block, the gold standard, and very thick. If I go try to tear this, and you'll see some calcifications. These are implants from 05, so 20-year-old. And we're very grateful to this very nice lady from Tennessee. And she has many symptoms of the breast implant illness. And you can see if I put this over the ruler, you can see how saran wrap thin this is. So complete end block and calcification right here, and all of this inflamed tissue removed along with the capsule, such that there's only good, healthy, viable tissue remaining behind. Remember, this was tricky surgery because it was below the muscle. Now, new pair of gloves. As I was dissecting now, let me go ahead and show you full thickness volume. As you'll see, if I roll this around and I put this together, you can see the volume of this that's removed is a good fraction of the implant itself. But this is done for contouring purposes given the severe ptosis she had. This is the left chest mass that I removed. It went down to the axillary area. It did not look right. It does not palpate right. And so as I go in right here, you will see it has a different consistency to it. And we'll see what the pathologist says. I'm going to go ahead and get a new pickup. And as you will see right here, I'm going to cut through the implant capsule. Again, pretty much the same thing. End block, the gold standard. And I'm going to go ahead and go in here. Complete total capsule removal. And again, as you will see, my scissor as I cut through. One thing I want to mention here is this is exactly how the implant was sitting. So you can see the muscle fibers here, and it was flipped upside down, which is not uncommon. And you actually can hear the crunchiness of the capsule. So I'm going to pull this out. So as I pull this out, there's some fluid around. And as you'll see, this is that leaching of that silicone from the silicone shell of the saline implant. 380 Mentor, and what is an intact overfilled implant. And again, you will see the relatively very thin areas of the capsule. Complete removal, even this tissue right here at the back. Complete removal. And if I cut through this, you can see actually it's a big hard mass, and that's why I've had to remove it. So overall, I'm very happy and content with how the whole dissection has gone. So the implants will be returned to the patient, capsules to be sent to pathology separately, right and left, to rule out that rare BIAL, CL, CD30 analysis, rule out malignancy, rule out breast cancer, rule out any abnormal pathology, cultures for Arabic and Arabic and fungal, this left chest mass to be sent separately. We'll see what that shows. And then overall, very happy with how she got and was reconstructed so that she has what is a nice pseudo lift, aesthetic recontouring of the chest breast minus the unnecessary cutting in and around the nipple areola. So this is Dr. Khan, executive plastic surgery. The Khan procedure, no need for the unnecessary lift, no need for the unnecessary drains. Blood loss was less than 5 cc's on each side. Cultures for Arabic and fungal. Capsules always sent to pathology. CD30 analysis, rule out that lymphoma. High definition pictures and videos of the chest wall showing complete removal of the capsule and implant off of the chest wall. This is by far the most important aspect. And then cutting open on the table. Twilight deep sedation, returning the implants to the patient, and no matter what the age and comorbidities of the patients, all of them get this 100-100-0 rule. 100% of the time, 100% of the capsule is removed, with 0% of the capsule remaining behind. Back then, when they were putting the saline implants, they should have banned them for reconstruction, for cosmetic, and not only silicone implants, but saline implants, because all of these cause the same hurt and harm. This is Dr. Khan, executive plastic surgery.